Hello, everyone. My name is Isho Haji, and this is Brett and Charlene, and our topic is on homelessness as a social justice and public health issue. So there is a lack of general agreement on the definition of homelessness, and maybe this difference is maybe due to the inability to differentiate between people who are homeless and those who are facing extreme poverty. Or maybe there are groups of people who face homelessness, but they do not fit into any of the categories of homelessness already established. So these definitions depend on the organization and those who they plan to serve. And in the Emergency Assistance and Rapid Transition to Housing Act, the definition affects who is eligible for various HUD-funded homeless assistance programs. And the new definition currently includes 4 broad categories. One is if they reside in a place that is inhabitable, and also people who lose their primary residence, as well as families with children with unaccompanied youth, and then also people fleeing from violence-related situations. So why is this important? Providing resources and interventions for homeless people with the intent in getting them situated into housing is not only good for the individual, but also for the community as well. Homeless individuals can suffer from anxiety because of the lack of adequate space, and also situational depression, moving around from place to place and not knowing when their next hot meal or shower will be. So, and because of this, there can be physical and social deterioration, as well as victimization and ostracization from outsiders. Housing and resources provide the stability that they need to address unemployment, addiction, mental health, as well as physical health. And with that stability, they can contribute to society once again. And also this would save hospitals thousands of dollars in emergency care costs. So homelessness first began, or the idea of homelessness before the 20th century was illustrated as men traveling from place to place in search of work. And the solution was increasing the amount of jobs that are available. So, but right now, homelessness is one in which the solution is more housing. And during the era of the New Deal and forward, with the idea of segregation in mind, the federal government began a program designed to increase America's housing stock for the white middle class and lower middle class families. And this was known as white flight. People of color were pushed into urban housing projects, and they refused to insure mortgage interest in and around African-American neighborhoods. This policy became known as redlining, and the tax credit program for low-income housing prevented integration, and as a result of this, the tax law worsened the effects of past laws like exclusionary zoning, pushing people into segregated neighborhoods that lacked opportunities. Currently, gentrification of inner cities and the disparity between housing costs and minimum wage have increased homelessness. So right now, homelessness in the United States in 2019 during one night had 567,715 people experiencing homelessness, and 70% of the adults in households were without children. 63% were sheltered and 37% were unsheltered. And 96,141 individuals experienced chronic homelessness, and 2/3 of them were unsheltered. So where is homelessness headed currently? 29 states experienced a decrease in homelessness between 2018 and 2019, and 21 states reported an increase in homelessness. California alone experienced a 16.4% increase, more than the national increase of every state combined. In the orange, overall, you can see homelessness is on a decline since 2007. And in yellow, sheltered people experiencing homelessness is on a decline. In green, unsheltered people experiencing homelessness is increasing back up, but it is less than it was when it was 2007.
3 weeks into our term, our cohort collectively defined injustice, unequal distribution of benefits and burdens, and disenfranchisement, and is often seen and unfelt by those in power. The right to adequate housing was declared in both the 1948 Universal Declaration of Human Rights and the 1966 International Covenant on Economic, Social, and Cultural Rights. Adequate is defined as affordable and proximal to necessary resources such as schools, healthcare facilities, and employment opportunities. It also means safe, pollution-free neighborhoods. The right to adequate housing doesn't require that governments build a home for every person, but it does exceed the idea that a house is simply 4 walls and a roof. It asserts that everyone should have access to the means with which to experience safety, privacy, comfort, and dignity. Homelessness is disenfranchisement. However, it is imperative to understand who shoulders a disproportionate burden in overrepresentation amongst those experiencing homelessness. In a 2016 count, those who identified as Black or African American comprised 39% of people experiencing homelessness, even though they made up 13% of the US population. In proportion to their share of the population, Native Americans and Pacific Islanders are the most overrepresented. A third of those surveyed were homeless with their families, and almost a quarter were children. Even though LGBTQ youth only make up 5 to 10% of the general population, they're an estimated 30 to 45% of youths experiencing homelessness. The ability to properly capture the numbers and demographics of those who are homeless is difficult. Many people are wary of the stigma of homelessness, and not everyone who is homeless is unsheltered. Accessing people living with friends and family makes it challenging to get a clear understanding of how many people experience homelessness in a given year. Market justice promises only what one can acquire through individual efforts, regardless of historical injustices. In a meritocracy, failure is seen as a deficiency of the individual. Merit becomes subsidized by structural violence that John Galtung defined as the avoidable impairment of fundamental human needs, or the impairment of human life, which lowers the actual degree to which someone is able to meet their needs below that which would otherwise be possible. It is etched into our institutions almost to the point of invisibility, manifesting in stagnant wages, a widening wealth gap, skyrocketing costs of home ownership and rent, broad deregulation, and predatory mortgage lending practices. Dan Beauchamp championed a social justice model as a critique of market justice, arguing for public health to confront and resist all efforts to dishonor the integrity of human life in the name of progress, convenience, security, and prosperity. The disparate demographics of homelessness and the historical injustices that produce it culminate in physical and political inequities. Without the security and privacy of home, people are forced to live their lives in the open. Necessary and unavoidable activities of daily life become criminal. People can be fined or jailed for sitting or laying down in public, sleeping in their car, or asking for money. Even sharing food with someone who is homeless is a crime in some places. The right to vote is dependent on a physical address. On top of disenfranchisement, people face social erasure as they are treated like background noise. Cities have installed boulders, spike strips, and bars on benches to prevent public camping and sleeping. This is politely referred to as hostile or defensive architecture. Health inequities resulting from homelessness are extensive. Risk of infectious disease such as tuberculosis, HIV, and now COVID-19 is heightened. Addiction and mental health problems can be exacerbated or created by the trauma of homelessness. Pre-existing chronic diseases are more difficult to manage without stable housing, and comorbidities may develop or worsen. Exposure and the stigmatization of homelessness brings an increased risk of violence, and mortality rates elevate as a result of all of these factors. In addition to taxing the health and dignity of our fellow citizens, homelessness is expensive. When the cost of ambulance transports, emergency room visits, interactions with law enforcement, and potential jail time are factored in, it is estimated that the societal cost of allowing one person to be homeless ranges from $35,000 to $150,000 per year. Needless to say, with emergency rooms often operating as primary healthcare providers, the emergency health system is often overloaded and congested, and not as readily available for those experiencing life-threatening emergencies. Lastly, these inequities compound, increasing barriers for houseless people to find housing and employment. Transitional or affordable housing may have stipulations requiring sobriety. Increased interaction with law enforcement may result in a criminal record that reduces job opportunities. And the trauma of living without a home may cause or exacerbate mental illness that makes maintaining housing or employment challenging. Similarly, in order to access the benefits necessary to gain housing or employment, you often need a permanent address, telephone, and reliable transportation.
Now let's look at what's happening currently to end homelessness at a national level. The Interagency Council on Homelessness was established in 1987 to coordinate a federal, state, and local response against homelessness. The council is composed of the heads of 19 different government departments and agencies. This shows how widespread the problem is and how a coordinated response is necessary. The current solutions recommended by USICH to address the homelessness crisis include full services, starting with housing, to ensure people are sheltered and safe, and then next to address their healthcare and well-being, including any mental health or addiction recovery services. Another key component is getting career training or assistance, since being employed will help with self-efficacy and feeling of empowerment. Education is a really important attribute for youth, homeless youth. Also with adults, education about finances, health, and their rights. Prevention will be based on these services and a plan moving forward to continue addressing the root cause. Partnerships with community and government policies and programs help to form a safety net. Crisis response systems that are easily accessible to all and can form a backup plan. And lastly, reducing criminal justice involvement to ensure the safety and security of all in the community. Being homeless or threatened homeless is not a crime and should not be handled like one. Unfortunately, in 2013, there was a blanket policy and paradigm shift in the management of homelessness called Housing First. Essentially, this changed the goals to be speed to get people into shelter without any planning or service burdens attached. The thought was that if shelter was provided with no questions asked or no requirements for homeless, then more people would be unsheltered. Unfortunately, this led to an increase in the unsheltered homeless population. You can see in that black line starting in about 2014, immediately after this policy was passed. This also had a corresponding increase in funding and sheltered homeless also. The key lessons learned from this sort of kind of policy failure were that a blanket approach will not work because it is only addressing the symptom of not having shelter without addressing the root cause of the problem. Because the federal vouchers were only available for rapid housing programs, transitional full service housing, the full service programs were actually cut. This led to more availability of short-term emergency housing at the expense of a decrease in services that would actually prevent more homelessness. The recommendations after evaluation of Housing First initiative failed to ensure focusing on the root cause and ensuring full services to prevent homelessness in the future. Now let's look at some of the nonprofits that I've chosen in the San Francisco Bay Area that are actually addressing these problems. First is Options Recovery. Options Recovery was founded in 1996, and it was actually a drug court diversion from the criminal system. Clients were able to choose either prison time or a recovery program for drug-related offenses. In 2004, they opened their first transitional housing program using grants and private donors in the community. They have a full service program including mental health, counseling, addiction recovery, job training, and sober housing. It should be noted that they actually do not use the federal housing vouchers because of the many restrictions that came with Housing First. Our next nonprofit is Trinity Center. This is actually located in an affluent suburb, and the primary target population is working poor. They provide full services with 44 affordable housing units. They also have temporary shelters and a safe car park program. It's noticeable that they formed a partnership with local church, community, and government officials to get this type of program in such an affluent community, as typically strict zoning laws in the wealthier communities prevent these types of programs. Our last nonprofit is Larkin Street Youth Services. They were actually founded in 1984, and they've served over 75,000 youth. They provide full services to homeless youth, including healthcare, housing, employment, and education. They use a combination of private and public funding, and their most important contribution is they have an active participation in a national consortium to end homelessness through policy partnerships. And you can actually see their policy ties to USICH in the language of their vision, which repeats the phrase to end youth homelessness by making it a rare, brief, and one-time occurrence. Looking at these three nonprofits gives us our first recommendation based on their models. Essentially, it's a target population approach, and this should include full services addressing the root cause of the specific population. Now, while these models can be replicated to similar populations across the country, it is imperative that they would be customized by involving members of both the target population and the community to ensure full integration. USICH will continue its role to monitor and assess effectiveness, as well as giving guidance and assisting with creation and structure of new programs.
We could also take a data-driven approach. And we know that different agencies choose different populations to serve based on their interpretation of the definition of homelessness. So a data-driven approach that takes into account the needs of the community rather than just individuals is necessary to inform how to allocate resources and programs so that barriers can be removed. To combat homelessness, there needs to be a website that connects people with programs and resources that their community themselves need.
And our last recommendation is to interrupt the cycle of criminalization. In Eugene, Oregon, Cahoots has been a successful alternative model to police response for over 30 years. Interrupting the criminalization of poverty and homelessness is a tertiary response, but an important one to allow people access to critical resources. This builds a necessary trust between houseless communities and service providers. Based heavily on the Cahoots model, Portland Street Response was designed with high participation from Portland's houseless community. Their voice was elemental in determining the types of calls Portland Street Response will go on, what qualifications the staff will have, and what the uniforms will look like so people will feel safe when 911 does show up. Even though this is a tertiary response, it opens the door for secondary and primary interventions once dialogue and trust are established with local communities of houseless people.